Hi, I'm Dr. Ellie, and I'm here to talk to you about the fact that not all tooth pain actually requires a trip to the dentist. So some tooth pain and sensitivity is really better taken care of by you at home. The vital thing to know is which kind of pain can you take care of, and which kind of pain do you need to go quickly and see a professional for a dental intervention. Symptoms in the medical world, doctors talk about it. A symptom, for example, of tiredness. You can be tired and you simply need to go to sleep. Or being tired may be a sign that something else is going on in your body. And eventually, if you can't take care of the symptom of, say, tiredness with maybe diet or better nutrition, then maybe yes, you need to go and get tested. Maybe you need something that the doctor has to do or give you, or maybe his tests will have to go deeper to find out what's really going on. And it is exactly the same when you have sensitivity in your teeth. The first thing to think about is why you might have that sensitivity. And don't imagine straight away that you have a cavity. Not all sensitivity is a cavity. The way you look at pain in teeth and the way it's caused is by the cells that are inside the dentin of a tooth. Now, the dentin makes up the bulk of a tooth, and within that, there are these little cells called odontoblasts. And when an odontoblast is irritated, and it can be irritated by temperature change, it can be irritated when your dentist touches it with a tool, it can be irritated when you have a tooth cleaning because your hygienist has scaled around the dentin part of your root. And when an odontoblast, this is the cell that's inside the dentin, feels pressure of any kind or touch or temperature change, then it will relay to the nerves on the inside of your teeth that it's not happy. And the feeling that you get, whatever caused the pain, will be pretty much the same sharp, intense sensitivity. Think about if you've ever had your dentist touch your dentin. It feels terrible. That's why teeth are anesthetized before a dentist cuts into the tooth. Doesn't mean anything is really drastic, it just is the way it feels. There is no relativity to what's going on. So all pain felt by odontoblasts is going to sound like a real warning. They're there to warn you, and your nerve center in your teeth relays straight to your brain, and it's really intense. So sensitivity of the dentin can occur simply because you have a little bit of gum recession. Maybe you whitened your teeth with artificial whitening products and it made the gums recede. When you then drink some coffee or you drink something cold, it could be intensely painful. The touch of the liquid was felt as this intense pain. Try to identify how long that pain lasted for. If it was less than a minute, there's a very good chance that you at home with correct treatment can get that sensitivity to go away. Odontoblasts do signal alarms if they're feeling the movement of bacteria into the tooth, but that kind of pain, the pain that you have a cavity forming, would be more constant. It would be more erratic. It would be not connected with eating and drinking. It would be something that maybe you're lying down at night and suddenly that tooth feels painful. If that's the case, then yes, you may well want to go and see a dentist soon. But if your sensitivity can be taken away with good oral care, you may be able to deal with it better than a dentist. Because really, dentists don't have a solution for dentin sensitivity. I had a lady who had unfortunately caused recession on her teeth, and the pain was so intense she went to the dentist because she couldn't drink hot coffee or cold drinks. The only thing the dentist could do was take the nerves out of her teeth, do root canals, and then put crowns on the top. So this is a pretty intense thing for a patient to have done simply because you have sensitivity. She had actually done half of her mouth with that dental treatment when I met her. She never had to have the rest of her teeth treated. She simply had to use my complete mouth care system and xylitol at the end of meals to stop the sensitivity all by herself. So the message that I would have is try and identify why you might have sensitivity. Second thing is, can you treat it? If it's very short, it goes away quickly, chances are you can treat it by yourself with the system of care that I recommend and the regular use of xylitol. If that pain is erratic, seems to go on for longer than a minute, if it seems to be throbbing, that would be an indication that the nerve is already dying in that tooth and that my system isn't going to help a dead tooth come back to life. You need to go and get treatment. Go to an endodontist, get x-rays, find out what's really going wrong with that tooth before it becomes more serious. But I also in this video want to talk one more thing. There is a time when you have no signs and no symptoms, and you may have a real problem in your mouth. If you've been told that you need a deep cleaning, I've heard so many people write to me and say, I have no symptoms. My gums don't bleed. I have no pain. Why do I need a deep cleaning? Chronic periodontal disease with pockets is one thing that you cannot feel, you cannot see, you will not know. 50% of 30-year-olds have chronic periodontal disease. They have a disease in their mouth that could affect their body health. It can affect your heart health, can affect the inflammation in your body. If you're a diabetic, it can make your condition worse. If you have an artificial limb of some kind, if you're older, you can cause all kinds of problems in your body if you allow chronic periodontal disease to continue. This is very, very serious, and it has no symptom. No bleeding, no swelling, no pain. It's just a silent epidemic in this country right now. And I'm here to tell you that if your dentist has told you you need a deep cleaning, get on my complete mouth care system for 3 to 6 months first. Yes, before you go for cleaning. Because a cleaning isn't going to cure your problem. It's going to potentially maybe clean away some of the debris. But my complete mouth care system is really going to do a different kind of job. It's going to make your mouth healthier. It's going to help your gums, if you use the toothbrushes I recommend, help your pockets heal up. And when they heal up, the disease will go away. That's the only way to get that disease to disappear, is to actually heal the pockets around your teeth, which the strategies I use for gum massage, better toothbrushing, and the rinses that I recommend around the complete mouth care system, that can solve the pocketing problem usually within 3 to 6 months. Then go back, get an evaluation, and either have a cleaning or everything has gone well. You may not even need one. Now, if you want to measure the bacteria in your mouth, you can ask for a salivary test to ensure that your hidden silent periodontal disease has gone away. That's something you can do. And you can also do that test if you don't believe your dentist. I've done that for people, and yes, they found they really do have bacteria pathogens at a bad level. They get on my system, and within 3 to 6 months, they have gone away. If you do everything together, you have such a good chance of getting rid of this and avoiding those ongoing, perpetual, deep cleanings that are no fun for anybody. So for more information, do visit my website at drellie.com. I have a downloadable booklet about this system of care that I recommend, and there's also a video boot camp with 14 videos that go into all the details, how to brush your teeth, do the gum massage, buy the right toothbrushes, so that you can really take care of gum disease and the symptoms of sensitivity.